Be talking about a lot of these issues. We've just joined Twitter Live, YouTube Live, and Facebook Live. So let's get the show on the road. And please do help me as we go along. Your questions are almost always better than mine. Welcome to the Nonprofit Report, your update on nonprofit organizations, issues, and leaders. I'm your host, Mark Oppenheim. Today we're discussing maternal health support, and we're speaking to hardworking nonprofits and nonprofit leaders and special guests. Hernández-Cancio, Vice President for Health Justice at the National Partnership for Women and Families in Washington, D.C. Marianne Fray, CEO of Maternity Care Coalition in Pennsylvania, and Kristin, Rowe, Finkbeiner, Executive Director and CEO of MomRising together in Washington. And a reminder to Zoom attendees that we'll take 3 snap polls during the show. We'll announce results. And your questions submitted through the Q&A function at the bottom of your screen will be included in our discussion. So thank you all for joining. It's just wonderful to have you here. We have a lot to unpack. So I'm going to set you up, and then I'm going to go to you, Sinsi. Today is World Maternal Health Day. We want to talk with you about this underreported issue. It seems that we have a 20% problem in this country. 20% of new mothers experience some type of mood or anxiety disorder in the weeks before, during, and after birth. And while the CDC reports that pregnancy-related deaths among Hispanic and Black women rose 20% in just 2020. Black women have the highest death rate at 55 deaths for every 100,000 live births, compared to white women whose maternal death rate is roughly a third of that. And now there's a seismic shift. It's a conservative shift at the Supreme Court. It has Samuel Alito writing an opinion removing constitutional protections for a woman's federally protected right to receive abortion services, a right supported by 62% of women and the majority of men in America. So Sinsi, if you could guide us through, what is the state of maternal health in the United States today from your perspective at the National Partnership for Women and Families?
Thank you so much, Mark, especially for this invitation. So right now, the state of maternal health in this country is in crisis. And in fact, it has been in crisis for a long time. A lot of people might not realize that of all the industrialized nations in this country, in the world, the United States has the worst maternal health outcomes. And let's not forget, especially today, that's Maternal Mental Health Day, that so much of, in addition to the terrible maternal mortality rates, we have to estimate that about 10 times that amount are women who've had near misses. Or
so why don't I see it, right? I mean, people talk about the statistics and we're in crisis, but I don't see it. I don't experience it. I go to my home. I read the newspapers. Why don't I see it as a white guy who is a professional wearing a nice suit? Why don't I see this?
Well, I think that there are the reasons for that, right? First of all, you said it yourself, you're a white guy, and the crisis is especially bad in communities of color. And the other thing is that, people don't realize that when women go through this kind of crisis of having a near miss, and I'm one example of that. I nearly died giving birth to my son, and nobody talks about it, right? Like nobody is really covering the issue of, it's like, okay, you lived, good luck. Forget the trauma, forget the real PTSD that you get when suddenly your cesarean incision rips open and bleeds out like a horror movie. Nobody is talking about that, not even within the healthcare system itself.
You mean you're just wrapped up and sent home and it's basically sayonara, the healthcare system?
Absolutely. And I was a person who, in my example, I had what they call Cadillac health insurance. I got sent home septic and back in the ER 3 hours later and almost died, right? This is not an outlier, right? This is not an outlier. And lately, if you read stories about what Beyonce went through, what Serena Williams went through, we're starting to get more attention to this. But they're still being treated as that's like a worst case scenario, as opposed to that is the actual result of generations of decision-making that have been done in this country that minimize women's pain, that minimize women's health, and, a million times over if that woman happens to be brown or Black.
So if I happen to not have health insurance and I experienced what you experienced, I'm dead.
Yeah, that's very possible. That's very possible. But the thing about the maternal health crisis, and this is very something that a lot of people don't know, is that people like to conflate in this country because they're afraid to talk about racism. That, oh, well, those are socioeconomic factors. Oh, they had pre-existing conditions. We heard that during COVID as well, right? And the truth of the matter is that, especially when it comes to maternal health, a Black woman cannot earn or educate herself out of the crisis. Right? Black women have worse outcomes. Educated Black women have worse outcomes than white women who haven't graduated from high school. So you can't come and say this is just a question of, trying to figure out the economic factors. This is about something very, very perverse and pervasive in our healthcare system.
Marianne, why is that? Is there a reason that, and I saw you nodding when the point about educated Black women have worse health, is there a reason for that?
I think that Sinsi really referred to it. It's structural racism. When you were talking, Sinsi, I actually thought about an experience that my sister and my mom had, which punctuates the truth of what you just said. So in 1955, in Jim Crow South, Alabama, my mother was, went to the doctor to have my sister, and it was segregated South. And my mom had the choice of going 100 miles to go to a integrated hospital or to a nearby doctor that didn't have all the, bells and whistles. And they were missionaries, so they didn't have a lot of the Cadillac insurance that you're referring to. But luckily, they chose to go to the local doctor and rest. She didn't hemorrhage or have any of those post-birth kind of negative outcomes. But what was that all about? What did that do to my mom? What did that do to her? She's a physician today committed to making sure that doesn't happen. But to your point, Mark, these are traumatic experiences that are built into the fabric of this country.
So we talk about systematic racism.
Sure.
A lot, until it becomes a term devoid of meaning. Even the people who believe in systematic racism sometimes can't unpack it.
Sure.
So is this really about the issue of understanding the particular needs that Black women have versus women of another race or white women, or is it or are these sort of subtle building up of little issues, a little bit more of a delay, this complete myth about people of different races having different pain thresholds, right? I mean, that's
yeah, it's sick.
It's insane. So is it a bunch of little things? Is it a particular systematic thing? Is it ignorance in terms of different needs? What is systematic racism in this case?
I sense he is like dying to respond. It's much more insidious. I do not think it's very, happenstance. It is incredibly systematic. And if you talk about what we were discussing prior to coming online about Ukraine, about Belarus, was that happenstance? We all discussed this whole dynamic between the dominant white supremacy and what happens, and how it is incredibly insidious and it's very intentional. So is it intentional in all cases, or is it also ignorant?
So I think it's really important to break this down a little bit more, because it's not a bunch of little things. It's literally hundreds of years of big things, yes, along with the little things. And there's a level of what is like the hierarchy of human value that is, yes, embedded in decision making, right? Mm-hmm. And then there's also the fact that there's implicit bias, right? And the fact that there's, especially when it comes to birthing, a hell of a lot of implicit and extremely explicit patriarchy, right? Of women being told that their pain isn't real, of women being told, this is something that has been well documented.
So you're saying it's partially a male attitudinal issue.
But more than the male attitudinal issue, it's the fact that for years, and like we know the impact of racism and traumatic stress now at the level of that it changes your DNA, right?
Weathering, right? It's
the weathering hypothesis. When you are going through trauma all the time, and you're dealing with post-traumatic stress, but without the post, right? That actually affects the physiology in ways that make you much more likely to have some of the chronic conditions that ended up making things worse for COVID, end up making things worse for birth. That is both. And then on top of that, there is there have been government decisions and private sector decisions that lay on, tons and tons of health risk in certain communities and take away a lot of the health resources from communities. So that's a perfect storm for the disaster that we are in.
Let's put Kristin into this. Kristin, are you finding that really, and then we're going to talk a little bit more about how maternal health has evolved recently and how it needs to continue to evolve. Kristin, do you find that in your work that the need is so thoroughly concentrated in particular communities as well at MomRising? And describe a little bit about the kind of services that you provide.
I just want to start out by plus oneing everything Marianne and Sinsi have just said. This conversation is so important, and I want to uplift some of the stats that were just brought out. Maternal health is in crisis in the United States of America. We are the only World Health Organization country that has increasing maternal deaths, and Black women are dying 2 to 3 times as often as white women.
Increasing maternal deaths.
Yes, and we just had an increase in the last year. This is outrageous. It's reprehensible. It cannot stand. And as we're talking about right now, there's no single silver bullet solution to this, but we have to try to get to solutions through multiple ways. One of the ways
with 100 other experts right now who are experts in maternal health, would they all be saying the same thing?
Oh, absolutely.
Yes.
They all be saying that
the numbers do not lie.
Yeah,
the numbers are very clear. There is no, vagueness in the numbers.
Yeah. They may focus more on one thing or another, but the big picture they'd all agree on, for sure.
Yeah, we have a crisis in America. We have a crisis of structural racism. We have a crisis of maternal health and morbidity. We have a crisis of infant mortality as well, because when we're talking about this, we're also talking about a whole family crisis. Other numbers, we're talking about numbers that don't lie. One of the things that we're looking at right now is the ways for solutions. So in the Congress right now, there's something called the Momnibuster that is moving forward that does look at many aspects that can be legislated to address structural racism and health inequities in our systems. So that's moving. Another thing that's moving forward is the Pregnancy Fairness Act. Why is that important? What other numbers need to be brought into this room? Well, the other numbers that can be brought into this room is the fact that being a mom is a greater predictor of wage and hiring discrimination than gender. And moms of color are experiencing.
Wait a second. Stop. Say that again.
Being a mom is a greater predictor of wage and hiring discrimination in the United States of America than gender. And here's the important part. That's not even the important part.
Being a mom
the important part is that moms of color, due to structural racism, are experiencing compounded wage and hiring discrimination to the extent that, and here's a place that we need to focus on the numbers that shows the intersectional impact of discrimination in America. Latina moms are earning just 46 cents to a white dad's dollar, and Black moms are earning just 52 cents to a white dad's dollar. Moms of all races and ethnicities combined overall are earning just 72 cents to dads of all races. So this is not okay. This is a point where we can look at what's happening. We can look at people who are dying, people who are losing wages, people who are having families in crisis. And then we can look at the flip side of what happens when we have equity. We all are better off. We are lives saved. We are more people who are thriving. We want to build together a nation where everyone can thrive. And we must stop this structural racism, this implicit bias, and women and moms from dying.
Is this where systemic difference really intersects? So in a sense, Kristin's whole statistic And Kristin, that was just fabulous. That was the aria from Aida. But what Kristin's basically saying is that we've got a multiply systemic issue, right? We have a systemic tilt against women, against moms, and based in race, right? So you have this.
Wait, I need to correct you because we need to stop that narrative that it's based in race. It is not based in race. It is based in racism, right? The fact that I have a different race or ethnicity is not the issue. It's what it means to walk around in this country.
Oh, it's the attitudinal. Well, that's what I meant. But thank you.
I know. But we all need to do our work because we saw this in the pandemic, right? Where people are like, oh, that's because those races, inherently have higher risk factors. No, that there are a few things where race, your actual race and your genetics make a difference. But in what we're talking about, that's not it. That's not it at all.
So how important is addressing health disparity? Because there's a piece of this that's really about everybody's attitude, right? It's also about the structures that have been built through history and correcting them. It's about language. There are all these different aspects, but providing health and equalizing that playing field has a palpable impact because, as you each have said, that if you can deal with the health disparities, you're also helping people to up their game in terms of their income generation, right? The expenses go down for healthcare and so on. So, to what extent is the provision of services to women requiring maternal health? Is that actually a multiplier effect in the lives of each of these women and throughout our society? Marianne, I'm gonna move it over to you, and then I'm gonna come over to you, Sinsi.
Yeah, I was thinking as you were talking is that payment reimbursement reform, payment reform on insurance could address some of these issues. So we're incentivizing doctors or medical providers, I should say, to only deliver certain types of care. So Medicaid, with 53% of the births in at least Pennsylvania are covered by Medicaid. We just had a successful postpartum extension for Medicaid beyond 12 months, beyond 6 months, and that was critical. But if you think about what it means to not have insurance coverage postpartum or prenatally, we can unpack that all afternoon to really figure out, like, that is a lever a factor that is impacting birth outcomes, et cetera. So if we were to change that somehow and to instead of have insurers be paid for services, have them be paid for for outcomes. And that's something that I think is really missing in our medical system right now. And that, and I invite others to kind of build on that. But that is one of the things that many of the collaboratives that MCC is involved with, I know we're working with MomRising and other organizations, is to really beat that drum. We have got to fix the way that we have providers. And it's so uncoordinated. Our structures are not designed to deal with the whole person. It is very segmented and it's uncoordinated. And that leaves so many gaps. And that's why moms and birthing people are dying, because either they don't have
systemic changes that you want healthcare to move from transactional to holistic models. And you want reimbursement systems to be a reimbursement system that focuses on what is best for the mother.
Correct.
And what you're actually saying is that the transactional healthcare might work for men. I don't know if it does, frankly. But when you're talking about the holistic health of the child, and I don't mean to put holistic in front of this as if it's some magical word, but I'm saying that this dynamic between mother and child and from birthing and so on and so forth is so sensitive that making it transactional builds in perverse behaviors and attitudes. That's what you're saying. So
yes,
systemic thing that we need to think about, because when it comes to mothers and children, we've always recognized as a society that it's different. Sinsi, and then Kristin, could you comment on that, and particularly in the relationship to the work of your organizations, because we want to draw attention to the unique contribution that you each make.
So Mark, I would love to have you invite us to have a conversation specifically about how we get to a payment and delivery system that actually is equitable and high quality, because that is a whole other thing to unpack.
Yeah.
And that's kind of like my favorite thing to talk about. But
that would be great. You know, if we could invite some insurance industry, and I'll really think about this. I'll talk it over with Rhea Titus, who is running this. But
so there's a lot of interesting work happening right now on the federal level about that. But I did want to highlight a couple of things. One is that, you know, for a country that is apparently really interested in the lives of babies, we really don't have a country that supports the actual lives of babies once they're not connected to their mother's wombs, right? So that's one thing that I think is an opportunity right now for us to be talking about. The other thing is about how improving the health of people of color, and especially moms and babies, helps everyone. One statistic that's important for all of us to hear is that right now in our schools, the majority of children are children of color. Let me say that again. Right now in our schools, the majority of children are children of color. We don't have a lot of time to make sure they're healthy so that they can pay their taxes and pay into Medicare. And so we are not going to thrive as a nation unless we get this right now, right? And so that's a huge motivator that people don't like to talk about. But as far as the kind of systemic things, in addition to the issue of like, we need everybody to have insurance, right? As long as insurance is a requirement for healthcare in this country. But in addition to that, we need to make sure that the insurance they have actually gets them something that's high quality that they need, right? Because insurance is a lot like a cell phone. It's only as good as the network it's on. And in our community, the networks, pardon my French, often suck. And the other thing that we know is that it's very clear that when for example, when infants are cared for by when Black infants are cared for by Black pediatricians, they're more likely to live, right?
We also have a rural-urban division in this country, in which we have huge swaths of the country have these real deficits. So we don't really have a rational system. Kristin, could you comment on that? And how do we make this system more rational? I mean, we can't just beat people over the head, right? We do have to change some of the incentives here. But how do we do this? Because the result of the poll that we just took, in which we asked whether, you know, who should pay for all this, and basically the idea was that mothers and children, everybody who responded said we should either have private insurance or the public purse, right? It was a mix. It was about 2/3 of those responded said that public purse, a third said private insurance, mostly, but also even there they allowed that it should be public purse as well for people in need. And then nobody selected only private insurance. There were a few people who just didn't know. How do we go about these changes in a way that accelerates change in the face of an increase in maternal deaths during this time? Kristin?
We need a lot of changes. We need not just one change, but we need several policy areas to move together, because we are behind the rest of the world when it comes to having a care infrastructure. What Sinsi just said about not really caring about, bothering about, paying attention to what happens as soon as the baby leaves the womb to the mom and to the baby is so important. We lack a care infrastructure. And let's just pause on that for a moment. In the United States of America, we do not have any national paid family medical leave program. Every other industrialized nation has this. Over 177 countries have this. We do not. That is one key way that we can also lower maternal mortality and infant mortality. When we look at who does have this, we have 11 states who have this critical policy in place, and we have some companies have this. All told, 23% of people in the United States of America have this policy. However, only 8% of low-wage workers have access to this policy. That's key. We need equitable access to all national workplace structural policies. We need structural change. Now, when we look at what's the care infrastructure is building Things like access to affordable childcare. Childcare costs more than college. So parents can go to work, so children can thrive, and so care workers can earn living wages. And so our economy can bloom. It includes things like the child tax credit, which we just had for 1 year, fully refundable. And it brought 40% of children in the United States of America out of poverty for that 1 year, the largest 1 year drop in poverty in the history of our nation. Then we let it go. We have proof positive that policies like are in the Momnibuster that go for equitable maternal health, that policies like paid family medical leave, childcare, and more with healthcare actually help lower the wage gaps between moms and non-moms, help lower costs to our country. You're talking about who pays, what's the cost. When we have paid family medical leave, studies show that there is a 40% drop in the need for SNAP, which is food stamps, and TANF, which is government support. So we help taxpayers save dollars. We save lives in healthcare. We lower the wage gaps between moms and non-moms. We help get at some of that structural racism. We need to do a lot of work to deal with structural racism, not just this. And we help move our country forward. So we do know solutions are possible. They're moving through Congress. They're moving through state legislatures. We need everybody who's watching, who's listening, to double down on standing up. At MomRising, we say, please text "we care," one word, to 747-464 and tell your U.S. senators. We'll connect you with that to get moving on the Momnibus, get moving on paid family medical leave, on paycheck fairness, on ending pregnancy discrimination, on childcare. We can do it all. Now, some people say you have issues. Yes, we have issues. But as the very famous, great, and beloved Audre Lorde said, we don't live single issue lives, so we don't have a single issue struggle. We can do many things at the same time. And in fact, we regularly do. And we need to do all of these things and more. So that's my short answer, or my long answer to your short question.
Well, I have a question for you all, because, this is going to sound like a stupid question, but I've got to ask it anyway. When these, it takes such an uphill climb to get these things passed to solve real problems, why would anybody oppose this? Is this an issue of, yeah, but I don't want to pay for it, right? Is that what it comes down to? Or is there a power dynamic that shifts, that, people don't want to give up power? What's going on? Why is this difficult? And I'm really asking because I really have no clue. Marianne, what do you think's going on here that this is such an uphill climb? Because it seems like, even if it's not somebody in my family, I want moms and kids to do well in this country.
We're so incredibly short-sighted, Mark, and I'm certain that Sinsi and Kristin will back this up and have the statistics. What MCC does is we are the voice of the voiceless, and that is why the answer I gave before led with a personal story. We are working with families every day that live with the lives behind the statistics that Sinsi and Kristin were talking about. But why it's not changes, because we don't have a coalition of the willing. People want what they want, and we have a greedy, self-serving power structure. And again, I'm going right back to that whole, we were talking about Belarus and Ukraine and white supremacy. Nobody wants to give up the power, and they don't care about the human value, the lives that we are talking about, that we care about, that MCC serves. There's such a devaluation of that. So, I don't have all these wonderful.
I don't think that your prosperity hurts me. Well, that's the thing. To me, it doesn't make sense, because you as a Black woman being healthy, that's not going to hurt me, right? You as a Black woman being able to work, hell, I could hire you, or you could hire me, right? You could create a job and I could be your employee, right? I mean, I don't get it. I don't get how that's something I should be afraid of.
And Sinsi, right? But let me just respond back to Mark, and then I'll go right to you. And what I would say back to you, Mark, is think about your parents and the things that you said, that your grandparents that fled, right? Belarus. Why did those people do that? Were they thinking about the
well, there was a choice, right? Death or not dying, right?
But what I'm trying, but what I'm trying to say is, you're describing things in a rational sense, but what is driving this is an incredible it's a power imbalance. And I really can't address it without stating the very obvious, is that it's not about whether I could give you a job or you could, that's not it. It's about if I'm a white male from way back when, I have privilege, I am blind to what another person, I just don't get it. You said you don't get it, but I'm telling you that it is baked into the culture and psyches of so many of us. And let me tell you something, it's baked into a lot of Black and brown people too.
So in many respects, because I'm white, because I'm male, because I'm not a woman, I'm not paying attention to this.
Yeah,
but
I really ought to be. I really ought to be. If I look at myself and I'm thinking, I'm a good person.
Yeah. But I'm not
You have to work at being a good person, which means that I have to be aware of some of Kristin's statistics, and I have to think, well, wait a second, this doesn't make any sense whatsoever, right?
But it's more insidious. It's even more insidious, and I would even say evil than that, right? And I think I wanna elevate two things.
I love being called evil at that.
No, not you. I'm talking about this. I'm talking about the system, not you.
Yes.
And that is number one. Number one, the medical industrial complex is a for-profit venture, right? That is extractive, right? People literally make money off of other people suffering. Like this is not revolutionary. That is the business model, right? And so when we're talking about how do we change how care is paid for, and rather than doing what we do now, which is like we pay for volume. Like doctors will keep doing things and doing things and doing things and doing the most expensive things because they will get paid for it, rather than really like paying for value. What is actually going to help that person in that moment? Mm-hmm. And guess what? Not all of it is clinical. A lot of it is a non-clinical support. Mm-hmm. And not all of it is within these big healthcare conglomerates. It's in birth centers, it's in home birth, it's in doulas. And so that is a threat. And in fact, even having midwives, doctors right now, AMA, those folks like that, they see it as a threat, right? So there are issues that are baked into that. But the other thing that I think is really important to elevate is the fact that, how many people right now, this debate about getting rid of student debt are like, I had to pay my debt. That's not fair for someone else to get it free. Poll after poll is showing that this is how Americans think. If I had to do something and I figured it out, then everyone else should be able to do it without even thinking about, that cost. It's almost like going into a fraternity and being hazed, right? Like if I went through this suffering, you're all going to go to the suffering. And if you're not able to tolerate that suffering because you have a lot less to start with, too bad. They don't want to.
Also, the costs are so different. We're going to have another discussion. I can already see this. And the next discussion, what we're going to do is we're going to bar any discussion of this show's topic or dominant topic, and we're going to focus on practical healthcare measures. And we will dive more deeply into some of these legislative initiatives. But Kristin, we're going to give you the last word. Tell us what we should do, what action we should take. Beyond dialing a number and making a contribution, but I'm really serious. Let's say we didn't even know your organization. In our personal lives, in our thinking, what kind of change should we start in ourselves, in our personal lives, in order to change this situation? Kristin?
Well, first, make sure that you get involved and follow the Maternity Care Coalition and the National Partnership for Women and Families to get ongoing details about how you can get involved. This is a long fight. This is not going to happen overnight. And so making sure that you're staying in touch with what's happening, with the opportunities for change, with the levers of change that you can help make happen is really important, because we've talked about a lot needs to change. So get involved again with the Maternity Care Coalition, with the National Partnership for Women and Families. MomRising obviously also works on this, and supporting as many organizations as possible that are working on this and paying attention is important too. The second thing is check your blinders. Now, this is really important. When we're looking at what's happening in the United States of America, a lot is being made invisible, overlooked, and people are dying. And so when we are engaged in this, stories are very, 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 very important. So feel confident in sharing your story about what's happened to you with pregnancy, childbirth, and having children. And also, importantly, in listening very closely to the stories of people around us and our communities who are often rendered invisible. That is also really important. And I want to share that stories do three things. Stories tell people that we're not alone. We've talked about this. This is an invisible crisis. It's framed as an epidemic of personal failures. It's framed as moms, particularly moms of color, doing something wrong. That is not true.
In other words,
when this many people are having the same type of crisis at the same time, we don't have an epidemic of personal failures. We have structural issues that we can and must address, and we can and must address structural racism in the United States of America. So stories do that. Stories also tell the media what's going on, because the media often overlooks as well. And stories help change public policy. They're a big wake-up call to our Congress, who frankly do not look like the United States of America. We don't have political parity yet. So take your blinders, check your blinders, read other people's stories, join the Maternity Care Coalition, join the National Partnership for Women and Families, get involved with MomRising, and stay involved in the long haul.
What a concept, doing the right things for moms and kids. What a concept. Isn't this part of our founding principles? Isn't this embedded in every single religious and humanistic tradition that we have? I'd like to thank you all. I know you're going to be reluctant guests to our next show, but can I get a commitment to come back and let's continue the discussion?
Absolutely.
Thanks so much. Sinsi Hernández-Cancio, Vice President for Health Justice at the National Partnership for Women and Families in DC. Marianne Fray, CEO of Maternity Care Coalition in Pennsylvania, and Kristin Rowe Finkbeiner, Executive Director and CEO at MomRising together in Washington. You are just so wonderful. Thank you for educating me. Thank you for sharing your wisdom, your knowledge. Please thank your staffs, your donors, your constituents, and all the people who support your cause. We are going to have another wonderful show on Tuesday, this one about supporting military service and families during National Military Appreciation Month, and that's coming on next Tuesday. And everybody stay safe, and we'll see you all again quite soon to continue this important discussion. Thank you.
Thank you.